I'm coming to tell you about this particular excerpt of a documentary that we're doing. Now, across Ghana, illegal mining activities, as you're well aware of, have left many water bodies destroyed. Now, thousands of acres of farmlands have been turned into wastelands. But little has been said about the devastating health implications of the community for the communities where these activities are being carried out with brute impunity. In the following documentary, which is an excerpt of that documentary for our hotline team, my colleague Seth Kwame Boateng visits community where death from poisoning is a new norm. He engages patients, doctors, researchers, and environmentalists for that documentary titled Mercury, The Mercury Effect.
The entire community is yet to recover from the disaster that hit the town a few years back. The lives of energetic young men were snuffed out like candle wicks. The community is still grieving. Before the ban on small-scale mining, Bordia was one of the busiest towns in the Wasekropon district. Illegal mining was the mainstay of the economy here, and it kept almost everybody, including the chiefs, busy. Nana Kwabna Boateng the first is the Tufuhine at Bordia Dompim.
Into match code na memiam no me pese me hu se Mercury ni nyina afirim into metumi de shema no na mafim se be Mercury me fim ansa na matoto be no akire no e ma me kobo wa na eniye de to be kwa me bo wa na moja wom.
This is scary because mercury is a very toxic chemical. Elemental methyl mercury are toxic to the central and peripheral nervous systems. The inhalation of mercury vapor can produce harmful effects on the nervous, digestive and immune systems, lungs and kidneys, and may be fatal. The Wasekropon Government Hospital is where the people of Bordia end up when the coughs start. I have come here to meet the medical officer in charge, Dr. Ahmed Zakistan Musa, who links Nana Kwabna Boateng's situation to a possible mercury inhalation.
Miners use mercury as a way of extracting gold. And sometimes in the process, they inhale the mercury vapors. So mercury vapors could be toxic to the lungs and the respiratory tract. So most of them, they come with cough. You treat them, you know, for the normal medicine you give for the cough, but they go back and they come with a cough. Because the cough is not due to infection, either viral or bacterial infection. It is actually due to what? The toxins of the mercury they are inhaling. So this is one of the main causes of what? Chronic cough in the mining areas.
Nana Kwabna Boateng coughed for over 2 months. He is not alone in this. There are many others like Kojo Mensah still battling for survival. In the case of Kojo Mensah, he has been coughing since 2011.
Still, I didn't press me. To be one of the things that coffee container. We go discussing children. Say, I say, Binya so much dubia. I come on my care. Gentle animal. I'm so okay.
Nti one on kwana obo
one on me boss me yi amama kama na menantia masabre menantia na me ase metizo then one is ya den de wa pa wo so de wa pa director
wo hwe de be na ma we na ba
gramsi no say it wa ibe de blase as a smoke as a bomb and we see it say car we see no then no timi masa ya de no. So, the noa na Mercury med.
Mercury,
and so the chigood, but the to be Masaya Deno. And the moon, I didn't hear any before the wedding. The other a capture. It will be shown no more for years. And so, you know.
Well, you can compare that to the effect of HIV and AIDS because it takes a while for you to begin to feel the symptoms of that infection. I still have the Secretary to the Interministerial Committee here. We almost let him go, but let me take a very quick reaction from him about this. I mean, that is also a part of the mining story that we need to deal with extensively. How do you respond to this? What strategy have been put in place going forward now that we want to do clean, proper mining? What are we doing about the use of mercury?
All right, first of all, I'll commend multimedia for actually bringing this forward because education is good for most of the people who are actually working in that area. For example, the Chief of Staff, Honorable Fremopar, no less than 3 people come to every week with kidney infections, and most of them are from the mining areas. So there's a direct correlation there. Now, we've done a lot of education. That's why I said about 6,000 of them, illegal miners then, have been trained at UMAT. And after the course, if you interview them, they come out and tell you that they didn't even know that mercury was hazardous to
So that training, was it a one-off thing, or is it something that you're continuing?
It will be continue until we actually absorb all the illegal miners, even the legal ones. Small Scale Miners Association of Ghana gave us about 800 of their members, which the government trained free of charge. And so we do it when the university is on recess. We've just done some, about 1,200. That's where we train most of them from the 3 northern regions. So I think knowledge is power. We just need to educate our brothers and sisters. And it's not even just happening in those areas. It can happen to us here. Because in those areas, there are plantations, cassava and all that, and they transport them here. And mercury can stay within the soil for a longer period. For a
very long time. So why isn't there some sort of directive to ban its use? Is it that those who mine cannot do without it?
The Interministerial Committee signed. I'm a member of the Minamata Convention. I was put on there because by virtue of being the secretary. So the Minamata Convention sees to the use of minimizing the use of hazardous chemicals, which includes mercury, but it doesn't ban it. But then there are ways, health and safety rules that you have to follow in using them.
So
that's the
you can use them, but there's a way that you can use them.
Yeah, hazardous chemicals, exactly. So there are ways in using them. For example, the chief said he actually rolls it and then puts it in his mouth. There are ways of using them and then disposing them off. That's why within the reforms, we've actually brought forward that the miners have to have PPEs. That's personal protection equipment and all that. These are all parts of the reforms, and then they cannot do that when they haven't actually been trained. That's why the government is training most of them to understand, mine responsibly.
Okay, well, thank you very much
for
your time this afternoon. Charles Bisu is Secretary to the Interministerial Committee on Illegal Mining. Still watching The Pulse with me, Gifty and Opia.